Kayla. I'm going to be your nurse today.
Hello.
I'm going to wash my hands and draw the curtain.
Perfect.
All right. And can you confirm with me your initials and your birthday?
JA, 2/14/95.
Okay. And do you know where we are right now?
We're in the hospital.
Okay. And do you know who the president is?
Joe Byron.
Okay. And can you tell me why you're here today?
For a head-to-toe assessment.
Okay. So I started my assessment at the door. I took a look at your skin. It is pink and warm. When I touched your wrist, I could feel that your skin was warm versus hot or cold. I'm going to take a look at your scalp now. Okay. I don't see any balding or any dry areas, so that is good. I'm going to move on to your eyes. I can see by looking at you that your sclera is white. I'm going to pull down a little bit. Your conjunctiva is nice and pink. There's no pus or drainage, and your pupils are equal. The next part of the eye assessment is I'm going to have you do the 6 cardinal gazes with me. So I'm going to have you take a look at this, and then I'm going to go up, over, down, up, and then perfect. Okay, and then now I'm going to check out your pupils. So I'm just going to have you look right at my nose. Okay, they're equal, round, and reactive to light. Now I'm going to have you take a look at this. Okay, and there is accommodation. Your eyes tracked this, which is really good. If we had the Snellen chart here, I would have it 20 feet from her. I would have her cover one eye and then read the smallest line that she could and then do the opposite eye just to see her vision. I'm going to take a look at your ears. I'm inspecting them for any discoloration, lumps, bumps. Now I'm going to feel them for any pain. Is there any pain when I touch?
Nope.
Okay. All right, and I'm going to take a look on the inside. Okay. So the inside, I could see your tympanic membrane was gray and pearly. And I'm going to perform the whisper test now. So I'm going to whisper a word and I want you to repeat back to me.
Dog.
Okay.
Cat.
Okay. Now I'm going to take a look at your nose. So just looking at it, it looks symmetrical. There's no lumps, bumps that I'm concerned about. I'll have you look up. Okay. I don't see any septal deviation. There's no mucus or anything in there that I'm worried about. I'm going to have you just occlude one side and breathe out. There you go, on the other side. Okay. Now I'm going to have you close your eyes for me. All right, I want you to sniff this for me. What is that?
Cinnamon.
Okay. And now I am going to take a look at your mouth. I'll have you open up. And then stick your tongue out and say ah. Okay, so I see that your oral mucosa is pink and moist. I'm going to have you stick your tongue out and then move it each direction, side, up, down. All right, that is good. Can you do a big smile for me and then frown? And then can you puff your lips out? Like, yeah, perfect. And then can I have you raise your eyebrows up for me? And can you grind your teeth side to side? Okay. I am also going to feel your TMJ joint, so I'm going to have you open up when I put my hands there. There we go. I'm feeling for any like cracking sound or feeling. I'm also going to check your tympanic arteries, so I'm just going to feel them. Okay, that's +2. I'm going to take a listen. I'll do this side. Okay, and then I'm going to have you close your eyes for me again. Okay. I want you to tell me if this sensation is sharp or dull.
Dull.
Okay, and then
Sharp.
okay. Perfect. You can open up your eyes for me. I'm going to just feel down, feel your lymph nodes. Again, before I finished the mouth exam, I would have tested her gag reflex. If I had a tongue depressor, I would have just advanced it down towards the back of her throat until it elicited the gag reflex, but I don't have that today, so I'm just going to start feeling. Alright, I don't feel any enlarged lymph nodes. Looking at her neck, I can see that it is symmetrical. There's no lumps or lesions. Her trachea is midline. So I am going to just take a quick feel for your carotid arteries. Good. And now this side. Good. And now I'm going to take a listen. Okay. Alright, I didn't hear any bruises. I'm going to check for jugular vein distension, so I'm going to lean my patient back at a 45-degree angle and I'll have her turn her head to the side. Alright, I don't see any distension. No distension. Perfect. I'll have her sit up for me. Alright, so I'm going to just check for some swollen lymph nodes at the clavicle area. I don't feel any, and I'm going to do the axilla, okay? I don't feel any there as well. So the next step is I am going to focus on the heart. So I'm going to palpate at the point of maximal impulse, and I'm just going to feel her heartbeat. Okay. Now I'm going to listen at the 5 points. So I'm going to do aortic, mitral, herbs, tricuspid, and mitral. Yeah, there we go. Aortic, pulmonic, herbs, tricuspid, and then mitral. And now I'm just going to listen again, but I'm going to listen with the bell side just to hear for any murmurs. Okay. Next, I am going to focus on the lungs. I'm going to have her kind of put her arms out a little bit, and I'm going to have you take a breath. Okay, her chest expansion is symmetrical. So now I am going to focus on her, I'm going to feel her chest wall to see if there's vibration when she says 99 for me.
99.
Okay.
99. 99. 99. 99. 99.
Okay. And now I'm going to take a listen to her lungs. Okay, now I want her to say 99 every time I move her my stethoscope.
99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
Okay, and that was muffled, so that's exactly what we wanted to hear with that. So I am going to move on to the arms. I am going to, so first taking a look at her arms, I'm going to feel her brachial pulse. I'm going to feel this side. Okay, and let me just see. So I can see that she doesn't have any edema when I try to pit both arms, which is good. I am going to test her skin turgor. Perfect. It went right back down, so there's no tensing there. I'm going to feel her pulses. Okay, they're both +2. That's good. Now I'm going to check her cap refill on each of her fingers. Okay, so they're both less than 3 seconds on both hands. The next thing I'm going to do is I am going to just auscultate for her renal and aortic arteries. I will have you lean back just a little bit for that. I'll do this one. did not hear any bruises there. All right. And then I am just also going to check for CVA tenderness. So I'm going to just do it quick. Do you feel any tenderness? No? Okay. I also want to percuss her chest. So I'm just going to, we're checking for dullness. Okay. And then I am going to move on to the abdomen. So I will have her take lay down, I guess. All right. So I'm going to first start out by inspecting the abdomen. So I'm just going to take a look. Okay, I'm just noting the shape and if there's any anything to be noted, basically anything abnormal. The next thing I do is listen to the abdomen. And then I am going to percuss the abdomen. I'm trying to feel for any dullness. And then I'm going to do some light palpation. And I'm just feeling for any enlarged organs or any pain or discomfort, maybe free fluid that she has in her abdomen. Okay, so that is good. And so the next thing I am going to do is I'm going to start the range of motion. So I will have her bring her leg up to her belly. And then I'm going to have you kind of bring it out just a little bit and then flex your ankle in and then out. Okay, and then I'll have you do the same on that side. It's going to be a little harder just because of there we go. Okay, perfect. And then I can have you sit up. I see that her feet moved good with the range of motion as well. I'm going to just feel her femoral pulses real quick. Okay, those are +2. The next thing I'm going to do is do her shoulders. So I'm going to make sure that those shrug. Perfect. And then can we put your arms out? Okay, and then can we bring them in and then forward? Okay, and then just, there we go. And then we can do up and out. There we go. And can we bring your feet up and out? Okay. And I am going to just check her feet for her pulses and also check her cap refill at the same time. Okay. Okay, +2, +2. And then I'm just going to check each one. Okay, they were all less than 3 seconds. So that is good. I am now going to have her touch her nose on each side. Yep. There we go. And then do the other one. Perfect. And now I will have you stand up for me. And I'm going to have you just walk. Okay. And now I'll have you walk heel to toe. Okay, and I'll have you walk on your toes. And now I'll have you walk on your heels. Okay. And then I will have you just stand right here. We're going to do the Romberg test. So I am going to just have you stand right there and cross your arms in front of you. And we're just watching her for any swaying. She does not appear to be swaying. So I'm going to have her relax, close your eyes, and then cross your arms in front of you again. Okay, there is still no swaying. So I will have her sit down. So I'm going to have you do rapid motions with her hands. So I'm going to have you go back and forth just like this. Okay. And now can you tap your feet rapidly? Okay, perfect. So she's got rapid repetitive motions down. So I am going to also just check her sensation in her extremities. So I'm going to have you close your eyes for me. All right, let me know if this is dull or sharp.
Dull.
Okay.
Sharp.
Okay.
Dull.
Mhm.
Sharp.
Okay.
Dull. Sharp.
Okay.
Dull.
Mhm.
Sharp.
All right, perfect. And then the next thing I am going to do is I am going to ask her to count backwards from 100 by sevens. We're testing her memory here.
100, 93, 86, 79, 72, 65, 58, 51, 44, 37, 30, 27, 16, 9 and 2.
Now I'm testing her comprehension, so I am going to be giving her this paper. I don't think you can see it. There we go. It has instructions on it that she'll follow. Okay, so she's good at comprehension. And where were you on your birthday last year?
At work.
Okay, and I'm going to give you 4 words. I'm going to do truck, cup, spoon, ball. Can you
Cup.
repeat those? Yeah.
Truck, spoon, ball.
Yep. All right, and then I'm going to have you count backwards from 20 by 1. So just 20 back down to 1.
So 20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Okay, and then what were those 4 words?
Really test.
Yes.
Truck, cup, spoon, ball.
Perfect. Thank you so much for your time. This is the end of the head to toe assessment. Thank you.
you.